Now, here is the classic big blood loss, right? So up to a 30% total volume loss. Okay, that's potentially you could die from that. All right, what do we get? Here we're at normal. Extensive bleeding. We lose pressure and volume. Okay? Pressure, well, the quick response is the nervous system, right? Baroreceptors, chemoreceptors, and the cardiovascular responses. Endocrine system, the long-term hormonal, right? So ADH, angiotensin 2, aldosterone, and EPO. All of those will bump up blood volume. Our nervous system is going to bump up blood pressure. Angiotensin 2 is also going to bump up blood pressure. That gets us back to normal. Now, is our fluid volume normal at the end here? No, you're still really dry because you've lost 30% of your volume. So what would this patient look like? Would they be nice and pink and warm? No, they're going to look shocky even though they have a decent blood pressure, because they're so peripherally vasoconstricted to keep their blood pressure up that they have very little perfusion in their skin. So they're going to be white, they're going to be clammy, they're going to be cool to the touch, right? Even though they might have a blood pressure of 110/70. Okay, remember, the body defends blood pressure. It can't do it forever. You know, like if you leave this patient for a day, they're going to crash and burn. They need fluid, right? Because all that vasoconstriction is making their heart work really hard to not perfuse the body very well. And incidentally, they're going to be super thirsty. If you look in movies, a lot of times when you see somebody like injured on a battlefield or something like that, somebody comes along and is trying to give them fluid all the time. That's what really happens. Like, that's battlefield medicine. A lot of times you can't put an IV in somebody in the battlefield, but you can give them fluid to drink. And it very rapidly moves into the compartment that it's needed. So if you're ever dealing with somebody who's lost a lot of blood and they're conscious, make them drink. Give them something to drink. And you can actually support them until you get them somewhere else. All right, you've all heard this word, shock, right? And you know that it has something to do with the cardiovascular system. I would imagine by now you do anyway. So let's look a little bit at the death spiral, which is shock, okay? So we've had a homeostatic failure. Usually it's because of a severe reduction in blood volume, right? Massive hemorrhage of some kind, okay? So first thing that's going to be affected is your cardiac output. Why? Because your venous return is going to drop, right? You're going to have very little EDV, so you're going to have very little stroke volume, okay? Now, that is going to be detected rather quickly by the heart, okay? So we're going to have decreased blood flow to the heart muscle, right? So a little bit of ischemia. Leave that happening for any length of time, and now you're going to have a damage to the heart muscle, which is also the pump, right? So the more damaged the heart is by not having enough blood volume, the less the heart pumps because it's being damaged. Do you see why that's a death spiral, right? So that's point number one, potentially dangerous positive feedback loop. We need to keep the heart perfused if we're going to have any hope of saving the patient. Okay. Now we have our decreased cardiac output, so let's say the heart's getting enough. Well, we still, because of decreased cardiac output, are going to have a decreased blood pressure. That's going to lead to a decrease in peripheral blood flow, right? Poor perfusion, in other words. Poor perfusion is going to drive up our PCO2, drive down our pH, and we're going to start to get lactate, right, from acid load. All of these things can cause clots within the vessels, all right? So now another potentially bad positive feedback loop. More clots means more resistance. More resistance is poorer perfusion. Poorer perfusion gets you more clots. See? Round and round we go. Okay, now once we have our increased PCO2, lactate, and decreased pH, that is going to trigger inflammation. So we're going to have increased capillary permeability. So now we are not only dry, but we're losing blood into the interstitial space, right? We're losing fluid into the interstitial space because it's leaking out of the capillaries. That further reduces venous return, and we get our fourth positive feedback loop, right? The more leaky your capillaries, the less blood you have circulating, that triggers more inflammation and so on. Okay, then this decrease in arterial pressure, the sympathetic nervous system is going to respond to that. That's the nervous system regulation that we've been talking about. It's going to make massive vasoconstriction, right, all over the body. Your total peripheral resistance is going to get really high. Why? Because it's trying to fix this, right? It's trying to fix the blood pressure problem. How do you fix blood pressure? You vasoconstrict. Now the issue here is you don't have enough blood circulating, so you get massive vasoconstriction. Now the heart has very high afterload, right, because you're pushing against all this resistance. That causes further heart damage, muscle damage. The arterial pressures drop even more. Now we get a decreased blood flow to the CNS. We talked about that as a Cushing-like response, right? How did I call it? The CNS ischemic reflex, I think is how I referred to it, right? In other words, when the vasomotor center itself is starved for oxygen, it like turns all the sympathetic on that it can, right? So then we get a great big increase in more total peripheral resistance increase. That further leads to arterial perfusion problems. But we get into this other feedback loop where our falling pressures leads to poor blood flow in the brain. CNS is damaged. This is the critical bit. Now, once the vasomotor center is sick, it can't keep the sympathetic system on anymore, right? You see that? Because it's sick. It doesn't have enough oxygen to live. So then you lose your sympathetic activity, your pressure drops, now you have no blood pressure, and you die, right? So, you've killed your first patient. Just kidding. You didn't kill them, they killed themselves, right? Because they lost a bunch of blood and it all collapsed. But that's the example here, right? Is all these things start to play a role in saving the patient. Okay, so what do we do? How do we intervene? When you can, give fluid. That's the first thing we do. You know, they'll give you that in the bus, right? In the ambulance, they'll start a line, start giving you fluid, right? You're going to get probably some epinephrine if your blood pressure is low enough, right? That's going to help with the vasoconstriction. But ultimately, what's going to help this patient most is fluid, right? You got to give